So I mean, certainly in the UK where I'm based, it's pretty new still. So we are way behind the learning of some of the colleagues on this panel today. So as a psychiatrist, I think we're especially cautious about risk and prescribing. At the moment, there are only certain conditions in the UK that we would be allowed to prescribe for. It's quite a narrow range of people that would be able to offer medicinal cannabis to. And then it would be the same as with any other, medication for me, would be about, it's always that person's story and understanding what's brought them to see you and understanding their history and then thinking about risk factors. But as a psychiatrist, we're perhaps looking at risk in a slightly different way to perhaps physical health conditions. So we're very cautious, particularly in people with a history of psychosis, say, or with a significant history of self-harm.
So, I think it's very interesting. So in some ways, cannabis is like any other medicine. So, our approach is not too dissimilar. We look at what are some of the potential adverse events that can happen with the medication. And then we look at our risk factors of our individual patients. I think what differentiates cannabis a little bit more than other typical medications is, on the one hand, it's very safe. There's a lot of research that shows that there's minimal drug interactions. You can't die from it. No one's ever really died from cannabis. So from that standpoint, there's added safety. On the other hand, their sensitivities to patients are very, very different. And it's hard to predict who's going to be very sensitive to THC and who's not. And so there's a lot of sort of patient factors that you have to look at that are independent of the medication. So what patient might have problems based on their ability to take their medicines, their underlying risk for other conditions. So in some ways, it's very much like the medicine that we typically prescribe as doctors. In many ways, it's very different.
From my end, I would say that I usually always advise patients to start with a low dose and try mostly to see how much CBD would help them initially, especially in the more elderly patients and perhaps patients who already have prescribed medications because of interactions. And obviously, as Dr. Mintz said, there's a very different sensitivity between patients. Some patients can get a therapeutic effect with a very low dose, while others might need higher doses. And obviously, when prescribing a cannabis medicine, one needs to take into consideration whether this patient has used cannabis before, whether, there's perhaps a degree of tolerance, perhaps whether they've had any adverse effects to cannabis in the past, and so on. So one would need to screen for these things before recommending, any kind of cannabis medicine.
In my case, what I found is that I've been practicing it as a family doctor. So we take a very detailed history, and I believe it's cannabinoid medicine is what I look at it as, not just cannabis medicine, because there's a system that is working, which is known as the endocannabinoid system. So we look at this as 3 words. We say educate our patients that there's a system, we certify the patients, and we empower the patients. And that's pretty much our starting point. And what I look at it is understanding cannabis. I use the word titrate. And when it comes to pharmaceutical drugs, I use the word dose, because dose is a very synthetic form and it's going to be the same every time. In cannabis, I look at it as a food and as a serving, and it could vary depending on what fills that serving. So I use the word titrate and dose when it comes to variation. And then we teach the patients 3 basic rules. Dr. Uma says, hydrate before you medicate. because we explain to them that the side effects of cannabis are very important, that there's dehydration. We tell them to make sure that there's food on board, because if they don't have food on board and they get hypoglycemic, that will cause them more anxiety. And the third thing that's very important is to journal. And we say low and slow or very low and slow. And understanding cannabis is personalized medicine. And this is about you, the individual. And all the things that you've said about where is the patient as far as, are they cannabis naive? Are they a prior user? Are they self-medicating? These are the categories that I like to look at. And then we approach the patient and what their goals are in coming to me as a specialist.
Yeah, I agree with Dr. Uma, and education is key, especially if you go low and slow, which is a very good mantra, because the downside of doing that is that patients want to feel better quickly, and going low and slow is the right way to do it, but sometimes people can become impatient that they're not getting better quickly. So the way to overcome that is through education and let them know, sort of what to expect and what not to expect. And I think journaling is a great idea as well, to help the patient, sort of titrate and go low and slow. But I agree with Dr. Uber. Education is the key, letting them know what to expect so they can, not be disappointed.
Exactly, and also explaining to them what's happening in their body when they consume cannabis, the effects of it, and why they should expect a certain effect, and also explaining to them, the way it works in comparison or in contrast with other medications, because unfortunately, the advice that they get from other doctors who aren't so knowledgeable about cannabis sometimes leads to misinformation. They tend to get put off sometimes taking the medicine, or they're afraid that something is going to happen, and that sometimes can increase their side effects, because if they're, for example, consuming THC, it can trigger anxiety, and sometimes for them to be prepared on what to expect, it makes a very big difference on the therapeutic response that they get.